For 206 Japanese workers based in Wuhan, this was a most welcome return. A flight that brought medical supplies to the Chinese province fighting to contain the coronavirus delivered them back to safety in Japan, the first of some 650 Japanese citizens scheduled to be repatriated. On home soil, they spoke of the situation they were thankful to leave behind.
I am sincerely relieved to have returned on this charter flight. While we were there, it was a worrying situation which was changing very quickly.
Australia also plans to repatriate the most vulnerable of its 600 nationals.
We will be standing up Christmas Island as a quarantine area. They will be transported to Christmas Island, where we will also be putting in place the AUSMAT team, which will be travelling there to provide the medical support, and that will be supplemented as is necessary by other defence support which can assist.
The United States and South Korea are also both working to move their citizens out of China. As the international community mobilises, China is grinding to a near standstill. In Beijing, the streets are deserted, subway stations largely empty. In Wuhan, efforts to set up a dedicated hospital go on around the clock. The Chinese National Health Commission says it expects the outbreak to continue spreading and reach a peak in 10 days' time.
Well, here in Germany, authorities have confirmed 4 cases of the coronavirus. All 4 people are employees at the same auto supply company. It's believed they fell ill after a seminar with a colleague from China. The infected individuals have been quarantined in the hospital where they are receiving treatment. And meanwhile, Germany's health minister says there are plans to evacuate around 100 German nationals from Wuhan by plane.
We need to be vigilant and prepared, but we should maintain a proper sense of scale. For example, the 4 patients in Germany are having just mild symptoms, thank goodness. We now have the genome sequence for the virus. That was published on Twitter. And the first rapid test was developed here in Berlin. So gradually, we're learning more about the virus.
Let's get more on this story now. Derrick Williams from DW Science is with us here in studio. Hi, Derrick. We heard the German health minister, Jens Spahn, there saying we need to be vigilant, but we also have to have a proper sense of scale here. So how dangerous is this virus really?
Well, the Wuhan virus so far has proven to not be as deadly as either SARS or MERS, the 2 other coronaviruses that it's closely related to. SARS kills about 10% of the people who get it. MERS kills over 30% of the people who get it. So the mortality rate with this new virus is much, much lower than that. It's certainly under 5%. So that's the good news. That said, however, on the other hand, the good news being that it doesn't also appear to kill normal, healthy adults. It's mostly also affecting people with compromised immune systems and certainly also the elderly. However, that said, it is a serious disease, and the seriousness, which with a lot that's in many ways very similar to classic pneumonia, and so it has to be treated. And so the question is to what extent are healthcare providers going to be overwhelmed if really thousands and thousands and thousands of people get it all at once?
And that's why we're seeing efforts to contain this virus ramping up. And scientists in Australia now say they have grown a version of this virus in a lab. How could that help stop the virus? Well,
it's very important to have live stocks of the virus for a number of different reasons. First of all, it helps you in testing. When you're testing for vaccines, it helps you for selectivity and specificness of being able to target vaccines that will actually also that are within that area of coronavirus prevention. So it's important to have it. It's also important because in the course of testing vaccines, you have to be able to, a lot of it is animal testing, so you have to be able to infect the animals that you're testing your vaccines on with the virus. For that, you need stocks of virus. Also, another aspect of it is that it's not clear that everybody is actually contracting the disease. And so the numbers that we have of people who might have contracted it are still pretty vague. And so you would also be able to do what's called antibody testing. If you have a live virus, you can do some antibody testing. You can provide antibody testing that tells you how many people have actually had it. And that will, of course, improve the statistics. So we'll know more about how many people are getting it and how long and how many people are actually showing.
Okay, so that's an important step. At the same time, there are companies, scientists working on a vaccine. If you look at the SARS outbreak, it took several months to develop a vaccine. What is the time frame we're talking about here?
Well, the time frame, what's interesting is that, as you said, as we said earlier, this coronavirus is closely related to SARS and MERS. And so we're not starting from scratch. What's interesting, though, is in vaccine development is not coming up with a vaccine. It's the testing of the vaccine that actually takes a lot of time, because you have to make sure safety is going to be obviously paramount. And so the testing of the vaccine in animal models is going to take a great deal of time. And then obviously then you have the problems with production, ramping up production after you've proven that you have a safe vaccine. And so we're not talking about it's not a question of days or weeks. We're talking about certainly months or possibly even years.
All right, Derrick Williams from DW Science, thank you very much.